Valvular heart disease by Seth Meide. Valvular heart disease is damage or defect of one of the four valves, which is the mitral, aortic, tricuspid, or pulmonary, and it causes improper blood flow and pressure within the heart. Mitral and aortic valves are the most frequently affected. Valvular heart disease can either present as either stenotic or incompetent. Stenotic is hardening or narrowing of valves, which prevents valves to fully open. Incompetent is weakening of the muscles or a bacterial infection, which causes inadequate closing of the valve. A person can either acquire this through birth or congenital or throughout life, just through overuse. Many different ways to acquire it include heart valve tissue degeneration with age, rheumatic fever, a bacterial endocarditis, inflammation of the endocardium, through hypertension and atherosclerosis, or a heart attack. Ways it affects the body's function and structure are stenotic valves are once again narrowing, and that prevents blood flow into the next chamber, and then or it can be incompetent valves, which is improper closing, causing backflow into the previous chamber. These two problems can cause secondary problems, which include hypertrophy of the heart by overpumping of the heart because of the incompetent or stenotic valves, backup edema through backflow, which can be seen in the feet, ankles, hands, and lungs, depending on which valve is being affected, and can cause a possible MI, pulmonary embolism, or chronic heart failure. Symptoms of valvular heart disease include palpitations, chest pain through decreased oxygen supply by the heart, fatigued, once again through decreased oxygen supply to the body, dizziness and fainting, fever through endocarditis, and rapid weight gain through edema and backflow, which can once again be seen in the ankles, hands, feet, lungs. It's important to call an ambulance if you experience any severe chest pain and you know you have a valvular heart disease, or call your physician if you develop persistent shortness of breath, palpitations, or dizziness with an unknown cause. Prevalence of this includes of the aortic stenosis specifically, of the vitral or of the valvular heart diseases include moderate stenosis between the ages of 75 and 86 is 5%. Critical stenosis, which is extreme narrowing between 75 and 76 is 1 to 2%, and ages greater than 86 is 6%. Moderate and critical stenosis overall are more prevalent in women at 8.8% than men at 3.6%. Another study from the CDC, which went over the prevalence of all cardiac diseases and ranked them in most prevalent to least prevalent. So valvular pulmonic stenosis was 13.5% total, as you can see right here, of all cardiac diseases, and then you can see between children and adults. And then valvular aortic stenosis was 5.4% overall, and then 5.5% congenital, and 5.2% in adults. I compared many different charts for the prevalence because neither one said the exact same thing, so it's hard to get a specific answer. So in this study, there between the ages of 26 and 84, the prevalence of mitral valve disorder was 1 to 2%, and that was equal between men and women. Mitral valve disease was seen as the most common valvular lesion in this study, and at least moderate mitral valve regurgitation occurred in a frequency of 1.7% as adjusted to the U.S. adult population of 2,000, increasing from 0.5% to 9.3% between ages 18 to 75 years of age. And 71% of these cases were white, with 5.6% being black, and 20.8% were not specified. Medications are typically preventative healthcare, which is a heart-healthy lifestyle, and then doctors usually adopt the watch and wait policy for mild asymptomatic cases, and then we'll put you on antibiotics prior to any surgery and make sure you get dental work done. After that, they will put you on long-term antibiotic therapy, which is recommended for valvular heart disease, especially with rheumatic fever. Every patient will then be put on antithrombotic or clot-preventing medications, a milder form of aspirin or ticlopidine, And then if it progresses, they will be put on a more potent anticoagulant, such as warfarin, especially with patients who continue to experience TIAs or transient ischemic attacks. And if the disease keeps getting worse and worse, they will resort to surgery, and they will do a balloon dilation for stenotic valve diseases, and then may do a valve surgery to repair or replace damaged valves, which can either be a prosthetic valve or a valve from an animal such as a pig. The type of replacement valve depends on the patient's age, condition, and specified valve affected. In this study, there was 4,808 patients on apixaban or warfarin, and it was to see who developed worse symptoms. There was no clear indication of one drug was better than the other, but it's important for PTs to understand that patients will be on blood thinners, and it's important to understand and see complications that may arise from blood thinners, as well as exercise contraindications. In this study, there is 17 patients who had an implantable cardioinverter defibrillator with valvular heart surgery, and it was to compare the overall arrhythmia-free survival of patients with ICD and without. There was no specific significant changes with an ICD or without in the study either. And it's important for PTs to know that an ICD may be present in patients with valvular heart surgery, and that contraindications to electrostimulation must be foreseen. And it's also important to understand the heart may not be able to pump as much through exercise, so do not overwork these patients. Lastly, valvular heart disease is more related to topic number 2 of the physiological function, because it specifically affects the valves within the heart, which affect the pumping of it. But it can be seen to correlate to the items 3 through 10 as well, as valvular heart disease can also be caused by atherosclerosis, hypertension, endocarditis, and can lead to chronic heart failure, angina, myocardial infarction, and lead to ischemic cascade through decreased oxygen supply. Once again, the most related topic would be the physiological function of the cardiac cycle.